Having more and more difficulties with noise in your ears or head? Problems with getting answers to your tinnitus questions? Bad experience with tinnitus remedies or help by so-called tinnitus experts? Who to trust, who can help, and where to go to find the right people in the right place? There is hope and there is a way. Tinnitus can be managed successfully. More good news, tinnitus can be treated and noise can even disappear from your mind and ears. How is this possible? I keep hearing you better get used to it. Well, please watch our video so you can learn all about it. Why are we so certain we can help most tinnitus sufferers? Metro Hearing and Tinnitus Treatment Clinic is one of the few clinics in Ontario and Canada specializing in treating tinnitus and other similar disorders for more than 15 years. From the very beginning, we are following the only working and proven to be successful approach to the tinnitus management and treatment. Now having many years of experience and thousands of patients who were successfully using our guidance and therapies, including treatment. We feel obligated to share our expertise and working knowledge of tinnitus relief, management, and removing tinnitus awareness from the minds of people suffering daily dealing with this condition. The only working and successful approach to tinnitus treatment is based on team effort. We are working as a group of professionals from different areas of expertise such as psychology, neuroscience, and audiology, helping our patients to find relief to their problems caused by conditions such as tinnitus, low sound tolerance, misophonia, and all combinations of symptoms caused by some or all of these conditions. Our specialists represent a very unique and highly educated group of professionals specializing in all aspects and problems caused by conditions such as tinnitus, misophonia, and hyperacusis. The reason behind this approach to therapy and treatments is very simple, is that tinnitus is taking place in different parts of our brain. Feeling and hearing in our ears is just a translation your brain is using to make us aware of the tinnitus presence. So the purpose of this video is to give you some understanding of what is important to know about tinnitus. Also, we would let you know what we could do for you and how we can help you. For this purpose, typical tinnitus catastrophic level, based on tinnitus handicap inventory, therapy process, will be outlined and explained. Catastrophic level of tinnitus has all elements causing high levels of anxiety, problems with quality of sleep, low tolerance to sound, where exposure to sound is known to make the tinnitus noise much louder and worse. Working for many years with people suffering from chronic tinnitus, we have noticed on many occasions that the tinnitus knowledge, regardless of their efforts, is very limited. There are plenty of sources of information about tinnitus, tinnitus management and relief one can find over the internet. Unfortunately, most of this information is not based on scientific findings or proven to be successful. There is also a large amount of unverified information, including many very tempting offers and solutions going as far as recommending magic pills. Sometimes advertising includes claims made by the people we would consider trustworthy, such as doctors or scientists. But if you try to check them out, you are going to learn there are no people you could find or research findings you could verify, just some corporations involved in selling other magic pills. This is very important that tinnitus sufferers talk about tinnitus with their family physicians. This is what we strongly recommend for many reasons. The next step is usually to visit the ear, throat, and nose specialist. This is a very important step because this specialist is needed to check patients for possible presence of other medical conditions known to cause tinnitus. As you can see on the screen, there are plenty of tinnitus onset causes. Unfortunately, an ENT specialist is not a person who is usually able to treat tinnitus or spend a long time trying to explain to the patient all implications of the tinnitus onset and possible treatment or therapy options. There is hope. There are some proven and universal recommended approaches to tinnitus management, therapy, or treatment. They are recommended by the American Tinnitus Association. They are also effective that they are verified and recommended by College of Family Physicians and otolaryngologists in most countries, including America, as you can see on the screen. For many years, the most successful way to help tinnitus sufferers is based on the work by an American scientist, Professor Pavel J. Yastreboff, his colleagues, and some specialized therapies offered by the modern psychology such as cognitive behavioral therapy and others. Tinnitus retraining therapy by Professor Yastreboff is a long-term therapy, and it should not be mistaken for sound therapy or masking. Used commonly in many hearing aid clinics. Actually, masking should be avoided as it is known to cause many problems to tinnitus sufferers. Also, hearing aids should not be recommended for all tinnitus sufferers, especially for patients with low sound tolerance. For all people suffering from low sound tolerance symptoms, hearing aids may have a negative effect on tinnitus, making it even more difficult and more annoying. Best known approach to tinnitus therapy includes a highly specialized assessment and test battery. Please don't mistake this procedure with a hearing test. Based on the findings and assessment results, we can provide tinnitus sufferers with all available options, including a highly personalized tinnitus treatment plan. Please note that not always a complete treatment or even the therapy will be recommended. Many times, tinnitus sufferers leave our clinic equipped with the knowledge and a set of instructions, allowing them to successfully manage or work with the tinnitus symptoms that they are experiencing. Sometimes tinnitus causes severe distress and problems on many levels, affecting not only their well-being, but the ability to function in any environment. For tinnitus sufferers having so many difficulties with tinnitus symptoms, we may recommend treatment or therapy, especially if patients qualify and are willing to work with us, following our instructions and doing their part. Tinnitus treatment is recommended mostly to moderate to catastrophic tinnitus level sufferers, and especially to all the people having some additional problems, such as low tolerance to sound, hearing loss, high levels of stress, and anxiety. Please note that Category 4, or tinnitus sufferers having problems with loudness or nature of some sounds, are known to have some severe difficulties with the regular and standard hearing aids, even with them having hearing loss at the same time. Only specialized and highly personalized treatment should be used to remove all low sound tolerance symptoms, including very high levels of anxiety. With the low sound tolerance of hyperacusis symptoms removed, other problems including tinnitus and hearing loss may be addressed. It is very critical and necessary for the success of the treatment program to address high levels of anxiety and stress caused by tinnitus presence, and very often by some other emotional problems. This part of the highly personalized treatment is provided by a fully certified psychotherapist and registered psychologist. Number of specialized therapies based on what the patient needs are used and proven to be successful over the years. In many professional clinics working with the tinnitus sufferers, such as our clinic, and many others all around the world. Successful tinnitus therapy or treatment is based on neuroscience scientific research and understanding how the human brain processes certain nerve signals. High levels of expertise and very good experience are required to implement some of the habitual and brain conditioning principles. So audiology can be helpful, but neuroscience and psychology parts are still the utmost important in the successful therapy or treatment process. In simple terms, there's no cure for tinnitus. Tinnitus is a condition taking place in our brain and it is not located in our ears. The only proven to be successful way of removing tinnitus symptoms, including noise in the ears or head, insomnia, anxiety, difficulties to focus or to stay focused, and many others, is based on rewiring. some neural pathways which are just like wires connecting tinnitus process and our awareness. And one of the main parts of this work is based on tinnitus retraining therapy by introducing habituation, while others are designed to remove noise and other tinnitus symptoms from our conscious mind. This treatment success ratio is known to be very high, as it is between 87 and 92% worldwide. Also, this treatment is universally used in US and the European Union countries for around 25 years. Unfortunately, based on the number of professionals used in some parts of the therapy or to compose treatment team, there are not too many places in North America where this treatment may be provided. One of the other reasons is that unfortunately it took a long time for the scientific community to recognize the value of Professor Pavel J. Yastreboff and Jonathan W. P. Hazel fundamental work, resulting in neurophysiological model of tinnitus and other disorders. At this moment, there are countless white papers available presenting research findings confirming the effectiveness of this treatment and its elements. This is why we are very happy to have clinicians personally trained by Professor Pavel Yastreboff, as well as having high levels of expertise from their time in University of London in the United Kingdom. Also, our registered psychologists as well as psychotherapists are having great success in applying their specialized skills in the therapy or treatment programs. Thank you for watching.